Greetings. Hi, my name is Lyle Melenka. I'm a respirologist working out of the Synergy Center. I have a fellowship in pulmonary medicine as well as a master's in epidemiology, and have been working out of the Synergy Center for the last 10 years. I also have a professorship at the university, and I'm an associate professor through the University of Alberta. I've been associated with the University of Alberta for close to 30 years now. One of my interests was when I was in training. I was working with an epidemiologist that had me interested in occupational medicine. His name is Dr. Don Enerson, and recently he was involved in the Melinda and Bill Gates Foundation, but also was working with the International Union Against Lung Disease and Tuberculosis. Together we did a surveillance program of Alberta farmers, and we had published this in the 1990s. This is how I started with an interest in occupational medicine and respiratory medicine. I also have a large clinical practice and do a lot of clinical respiratory medicine as well. Over 10 years ago, a colleague had noted that I was interested in occupational medicine. He was the business manager for the International Union of Insulators, and he came to me with a concern. The concern was he was concerned about colleagues in the industry dying. He said, what can we do about helping to reduce the risk of dying in members of the trade unions, and in particular the Insulators Union? This resulted in us developing a health surveillance program, which we call the Wellness of Workers program, or WOW program, as well as having a surveillance program that has been ongoing for the last 10 years. This program allows for members of the Insulators Union, if unwell or developing or identified as having health issues, to have their health status monitored and to be dealt with. But it has also allowed us to collect information on these fellows over a 10-year period of time, and we can actually see the effect of their work environment on their health status. We have extensive information collected on respiratory health, cardiac health, general health on this. We are currently at the stage of analyzing a great deal of this data, and we believe that this will be impactful at trying to improve working conditions for industrial workers here in Alberta, but also around the world. We have a unique opportunity with this work in light of the fact that we have been monitoring these fellows for 8 to 10 years and have extensive information on them. We anticipate that we will be able to come up with recommendations that may be useful at improving working conditions for industrial workers around the world. We are taking this to different levels. Working with the University Research Group, we are able to also take the information collected and look at it at a cellular level. So we are combining the clinical information with cellular information, which may allow us to understand mechanistically how some of these industrial hazards interact and cause health issues. I wanted to discuss our future plans with the research work that we have been doing. We believe that this is just sort of a start of a process of investigations that hopefully will be ongoing for an indefinite period of time. We are looking at different avenues with this. We certainly are interested in not only just respiratory health, but cardiac health, psychosocial health, and the opportunity with the Wellness of Workers program is also to look at various factors independently or each and in time. May help us identify is there a particular industrial product that is more hazardous than other products, for instance. and how to mitigate all of these things. I think another big part is understanding mechanistically how these exposures cause health issue and how they interact with various health systems. You know, for instance, can asbestos cause more than just respiratory issues, but can it be associated with cardiac issues as well? We truly enjoy this work and have developed quite a large collaborative group to work on this. We have myself as a respirologist. We have occupational physicians, a cardiologist working with us. We have an epidemiologist and a cell biologist as part of our research group. We think this broad group of people brings in a great deal of expertise in different areas, and it allows us to approach problems from different aspects, and I think allowing us to view old problems in a new way.